Blepharoplasty is a Greek word, obviously, as half of the words in medicine. It means eyelid rejuvenation. You have the upper eyelids and the lower eyelids. It's probably the first operation that somebody will have when they're looking at rejuvenating the face. And they usually start from that, and then they proceed to the face, or they do the eyelids and the face at the same time. The eyelids, there is a couple of things that can be kind of not right with them. So the main thing is excess skin in the upper eyes. Sometimes you can have puffy upper eyes because of fat, or hooded eyes. So this is the opposite. So you can remove a bit of excess skin, and you can remove a bit of fat, or you can add some fat if it's hooded. In the lower eyelids, you usually have baggy eyes, or just wrinkly eyes, or a lot of skin. So we tend to remove the excess fat and the excess skin. What's interesting with eyelid surgery is that the upper eyelid surgery is one of the easiest operations you can do in plastic surgery, and the lower eyelid surgery is one of the most difficult surgeries you can do in plastic surgery. People don't realize the thing is very similar. It's not very similar. That's why you need, again, a good surgeon, somebody with a lot of experience to do this sort of things, because especially in the lower eyelid, half a millimeter can make the difference between success and failure, and that's actually really important. The scars in eyelid surgery, in the upper eyelid surgery, there is always a scar in the crease in the eye. So the scar is, somebody can see the scar when your eyelid is closed, so you can never see your own scar. That's interesting. So it's a very, very fine scar. You can't really see it too much, and it's hidden in the crease. When you open your eyes, it's invisible. The lower eyelid scar, if we need a scar, because sometimes we can do the operation without a scar, is probably the best scar you can have in plastic surgery. Is what you call the invisible scar. I am trying to find the scar, and I'm actually looking for it intentionally, and I cannot see it, and under close examination. So it's usually just under the eyelashes, and you really cannot see it. It's invisible. But sometimes you can actually, and especially younger patients, when the eyelids are just puffy without actually excess skin, you can do what you call a transconjunctival operation, which means essentially that you go from inside the eyelid, creating a little inside scar that you cannot really see, and removing the fat, and on the outside it looks like not normal, like you got no scars at all. Not that if you had one, you could see it anyway.